A few years ago, I treated a woman in her early 70s who collapsed in her living room. Her phone was on the coffee table, maybe 4 feet away. She survived, but not because she reached that phone. She survived because her body remembered what to do before any help could possibly arrive. That moment changed how I think about emergencies, and it is why I am sharing this with you today. I am Dr. Michael Harrison. I spent 40 years treating patients in the hospital, and now I help people like you understand your health in a way that actually makes sense. Today's conversation is one I have wanted to have for a long time, because emergencies do not wait for perfect conditions. They do not care if your phone is charged. They do not care if it is in your pocket, and they certainly do not care if it is within arm's reach. Sitting with me today is someone whose expertise I deeply respect. Dr. Eleanor Winters spent 35 years as an emergency medicine physician and has dedicated her retirement to teaching seniors how to protect themselves in crisis moments. Dr. Winters, thank you for being here. Thank you, Michael. This topic is something I feel strongly about. I have seen too many emergencies become tragedies, not because of severity but because of panic and helplessness, and that breaks my heart because so often it could have been prevented. That is powerful. And it brings up something that concerns me deeply. Most seniors are told to call for help immediately when something goes wrong, but no one asks the harder question. What if you cannot reach your phone? What if your body will not cooperate in that moment? Exactly. And this is not rare, Michael. Falls, sudden dizziness, breathlessness, temporary weakness or paralysis. These moments often happen faster than a hand can reach a phone. I have seen it hundreds of times in the emergency department. Someone collapses, and the phone might as well be a mile away. And when that happens, fear takes over. I have seen it in my own patients. The panic in their eyes when they realize they are alone and cannot do the one thing everyone told them to do. Yes, the body stiffens, breathing becomes shallow, blood pressure spikes, and the systems meant to protect you begin to work against you. It is a cascade that can turn a survivable event into something far more dangerous. Before we continue, I want to be clear about something. While I am a physician sharing evidence-based information, this video is for educational purposes only. It is not a substitute for personalized medical advice from your own doctor who knows your specific health history. Always consult with your healthcare provider before making any changes to your health regimen. That said, let us get into it. What concerns me most is that seniors are never taught what their body can still do in those critical moments. They are taught dependence, not preparedness, and that leaves them vulnerable when they need strength the most. And that is tragic, Michael, because the body has emergency systems far older than phones, reflexes designed to preserve oxygen, movements that maintain blood flow, positions that reduce strain on the heart and brain. But if no one explains them ahead of time, the mind freezes, and freezing is what turns survivable events into dangerous ones. I have seen patients survive heart scares simply because they instinctively did one thing right, not medication, not technology, something far more basic, something their body remembered. That is because the body remembers what the mind rehearses. If you never rehearse safety, panic becomes the default. But if you practice calm responses now, your body is more likely to choose them later. So today is not about fear, it is about quiet confidence, and about dignity, because even when you are alone, you are not powerless. You never have been. In this episode, we are going to walk through 5 critical strategies that could save your life when help is not immediately available. We are going to cover what to do in the first 10 seconds after you realize you cannot reach help, how to position your body to protect your brain, how to use your breath to stabilize your heart, how small deliberate actions can buy you critical time, and why practicing these responses calmly now can completely change how your body reacts later. Not tricks, not myths, but principles supported by physiology and emergency medicine. Stay with us, especially if you live alone, especially if you have ever worried about falling, fainting, or freezing in place. By the end, you will not feel afraid, you will feel prepared. And preparation at any age is a form of freedom. Let us begin with number 5 on our list. The first thing most people get wrong in an emergency, the moment after they realize they cannot reach their phone. Before I explain the science, let me share a story that perfectly illustrates what I am talking about. I had a patient, let us call him Robert. Robert was 73 years old, a retired engineer, sharp as a tack. He lived alone after his wife passed, and prided himself on his independence. One evening he felt dizzy while making dinner. His phone was on the counter behind him, maybe 3 steps away. Robert told me something I will never forget. He said, "Doc, I felt like the floor was moving, and my first thought was to grab that phone no matter what, so I lunged for it." That lunge cost Robert a fractured wrist and a gash on his forehead when he missed the counter entirely. He lay on his kitchen floor for 40 minutes before a neighbor heard him calling out. And here is the thing, the dizziness would have passed in about 2 minutes if he had simply lowered himself safely to the ground. The first mistake most people make in an emergency happens immediately after they realize they cannot reach their phone. They start fighting the situation instead of stabilizing it. They try to crawl, they strain, they hold their breath, and without realizing it, they push their heart and brain into a dangerous stress response. Yes, this is where panic quietly causes harm. The moment the body senses loss of control, adrenaline surges, heart rate rises, blood pressure spikes, and for a senior body, especially one with hidden heart or vascular weakness, this sudden surge can turn a manageable event into a crisis. I have seen this repeatedly. A person feels dizzy or weak, but instead of grounding themselves, they rush to do something. They forget that doing the wrong thing too fast can be more dangerous than doing nothing at all. Exactly. The body does not need speed in that moment. It needs order. The brain needs oxygen. The heart needs stability. And both are protected not by movement but by positioning and breath. Research from Harvard Medical School and the American Heart Association confirms this. Calm posture alone can significantly reduce cardiac strain during acute events. Your position is not passive, it is protective. Survival begins with control, not motion. The first 10 to 20 seconds are not about escape, they are about preventing escalation. If you stabilize those seconds, you buy minutes, and minutes save lives. Let us talk about what escalation really looks like, because many seniors do not recognize it when it is happening. Escalation is subtle at first. Breathing becomes shallow, shoulders tighten, the jaw clenches, blood flow shifts away from the brain toward the limbs. This is the body preparing to run or fight, even when neither is possible. And when that happens while lying on the floor, dizziness worsens, consciousness can fade, things spiral quickly. But here is the hopeful part. The nervous system is highly trainable, even after 60, 70, or 80. Studies on neuroplasticity published in journals like Nature and The Lancet show that repeated calm responses become automatic over time. The body does not distinguish between rehearsal and reality. So if someone practices calm stabilization now, their body is more likely to choose it later. That is why we emphasize preparation over reaction. You do not rise to the occasion. You fall back on what the body already knows. Many seniors think emergency readiness requires strength or speed, but you are saying it requires familiarity. Yes, familiarity with your breath, familiarity with stillness, familiarity with the sensation of grounding yourself when the world feels unstable. This is far more protective than muscle strength in an emergency. Now let us move to number 4, which builds directly on what we just covered. The single body position that emergency physicians rely on when everything else is uncertain. A position that protects the brain, reduces cardiac strain, and buys time when help is delayed. When emergency physicians talk about buying time, there is one principle that comes before medication, before devices, and before diagnosis. It is body positioning, because gravity can either work against you or protect you in the first critical minutes. Position is medicine. Long before modern hospitals existed, physicians understood that how a body rests during distress determines whether blood reaches the brain or drains away from it. I have seen patients lose consciousness simply because they remained upright too long while feeling weak or dizzy, not because the event was severe, but because gravity quietly pulled blood away from the brain. Exactly. After 60, blood pressure regulation becomes slower. The vessels do not adjust as quickly, so standing or even sitting upright during distress can cause what we call cerebral underperfusion. That means not enough blood reaching the brain, which leads to fainting, confusion, or collapse. And once someone collapses uncontrolled, injuries compound the problem. Falls create a second emergency, fractures, head trauma, fear. That is why emergency medicine prioritizes prevention of collapse first. So let us be clear for everyone watching. When someone realizes they cannot reach their phone, what should their body's first instinct be? To lower itself safely and deliberately, not to fight gravity, but to cooperate with it. This single decision can determine whether the brain stays oxygenated or begins to shut down. That sounds simple, but in the moment it is counterintuitive. Most people try to stay upright at all costs because they associate upright with control, but physiology disagrees. When the body is horizontal, the heart does not have to fight gravity to supply the brain. Blood flow stabilizes, oxygen delivery improves, and strain on the heart decreases. Studies published in the Journal of Emergency Medicine and research from the Mayo Clinic show that supine positioning improves cerebral perfusion during hypotensive or presyncopal events. But positioning alone is not enough. Position must be paired with intention. A rushed collapse can cause injury. A controlled descent preserves safety and dignity. So the goal is not to drop, but to settle. Settle the body, settle the breath, settle the mind. This creates a cascade of protection. Heart rate slows, blood pressure stabilizes, the nervous system shifts away from alarm. I want to underline something for everyone watching. This is not about giving up. This is not weakness. It is choosing survival over pride. Many seniors fear lowering themselves because they worry they will not get back up. But staying upright during distress is far more dangerous than resting temporarily. I want to pause here and remind everyone, I am not suggesting you change any treatments or ignore your doctor's advice. What I am sharing today may inform a conversation with your healthcare provider, but any changes to your approach should be made under their guidance. Number 3 is something I see patients get wrong all the time. Once the body is positioned safely, the next battle is invisible. It is breathing, because in emergencies people do not stop breathing. They stop breathing correctly. Yes, and this mistake is one of the fastest ways consciousness is lost. Panic shortens the breath, the chest tightens, air moves in but oxygen does not move effectively into the blood. This is exactly what happened with a patient I will call Sarah. Sarah was 68, a former school teacher, lived with her daughter but was home alone most afternoons. She felt her heart racing one day while reading in her favorite chair. Her chest felt tight, her hands went cold. Sarah did everything right at first. She lowered herself to the floor near the couch, just like we have been describing, but then panic set in. She started breathing fast and hard, trying to get more air. She told me later, I thought if I could just breathe enough I would be okay. But within 2 minutes Sarah felt lightheaded. Her vision started going dark at the edges. She was certain she was dying. I have watched patients breathe rapidly and still starve the brain of oxygen. They think they are helping themselves, but they are actually accelerating the problem. Exactly. Fast, shallow breathing blows off carbon dioxide too quickly. That disrupts blood vessel regulation in the brain. The vessels constrict, blood flow drops, dizziness worsens, and this is not weakness, it is chemistry. The brain depends on a precise balance of oxygen and carbon dioxide. When that balance is lost, vision narrows, hearing fades, and confusion sets in. So the goal is not to breathe more, it is to breathe smarter. Emergency breathing is about slowing the system, not flooding it. When breath slows, the vagus nerve is activated, heart rate decreases, blood pressure steadies. The brain receives a clearer signal that the danger is being managed. Paramedics often coach breathing before doing anything else, because if the nervous system remains in alarm, no intervention works as well. And yet most people are never taught how to control breath under stress. Breath is the fastest way to communicate safety to the brain, faster than thought, faster than reassurance, faster than logic. So let us talk about the pattern itself. What makes this type of breathing different from what people usually try? It emphasizes length, not force. The exhale becomes longer than the inhale. This signals the body to release tension. Shoulders soften, jaw unclenches, blood vessels reopen. A simple rhythm would be breathing in for a count of 4, then breathing out for a count of 6 or 7. Slow and gentle. The exhale is where the calming happens, and this can be done lying on the floor. In fact, it is most effective there. The body is supported, the diaphragm can move freely, the heart does not fight gravity. I want to stress something here. This is not meditation. This is not relaxation for the sake of feeling better. This is emergency physiology. This is about preventing syncope, preventing cardiac overload, preventing the spiral that turns fear into collapse. When panic subsides, time stretches, seconds feel longer, decisions feel simpler, and survival becomes far more likely. This brings us to number 2, and pay close attention here. There is something many people never think to use during an emergency, even though it is always with them: their voice. Yes, and this is one of the most overlooked survival tools, because the voice is directly linked to the brain's alertness centers. Most people go silent when they feel weak or afraid. Silence feels instinctive. The body conserves energy. But in humans, controlled sound actually preserves consciousness. Neurologically, vocalization stimulates what we call the reticular activating system. This is the network that keeps the brain awake and responsive. So using the voice is not about calling for help when no one is around. It is about keeping yourself present, anchored, oriented in the moment. This reminds me of one of the most meaningful conversations I ever had with a patient. Her name was Margaret, though of course I have changed it for privacy. Margaret was 79 and had been having episodes of severe dizziness for months. One afternoon she felt one coming on while alone in her bedroom. Margaret had heard me explain this concept before, so instead of going quiet and closing her eyes, she started talking out loud. She counted the objects in her room. 1 lamp, 2 pillows, 3 books on the nightstand. She told me her own name, over and over. I am Margaret. I am in my bedroom. I am going to be. Okay, the dizziness lasted almost 4 minutes, but Margaret never lost consciousness. She said those words kept her tethered to the world. I have seen patients fade simply because they withdrew inward, their eyes closed, their breathing slowed too much, and once the voice goes quiet, the brain often follows. This is especially true during low blood pressure or near fainting episodes. So what kind of sound are we talking about here? Simple, steady, repetitive, speaking out loud, counting, naming objects, even repeating your own name. These actions activate multiple regions of the brain at once: language centers, memory, motor planning, and when circuits stay active, consciousness stays anchored. Whispering works. Even mouthing words silently works. The key is rhythm and intention. Some people watching may feel embarrassed by this idea, talking to yourself when you are alone on the floor. But embarrassment has no place in survival. Pride is not a life-saving tool. In emergencies, dignity comes from staying alive, not from appearing composed to no one. So between body position, breath, and voice, we are creating a triangle of stability. Support the body, calm the breath, engage the brain, and this triangle buys time. We are getting to the most important one now. Number 1 is something that ties everything else together. When the body is grounded, the breath is controlled, and the brain is engaged. There is one final risk that often goes unnoticed: circulation stalling. Stillness can be protective, but complete immobility can quietly create a new danger. Blood begins to pool, oxygen delivery slows, the body cools. This is especially true for seniors. After 60, the veins rely more heavily on muscle movement to return blood to the heart. When the muscles are completely still, circulation becomes sluggish, and that can deepen weakness. So the answer is not to get up. Standing too soon is risky. The answer is small movement, intentional movement, movements that work with gravity, not against it. I want to be very clear for everyone watching. These are not exercises, they are signals. Signals that tell the body, keep the blood moving, keep the system awake. What kinds of movements are safest in these moments? Gentle ones. Slow ankle flexing, pointing and relaxing the toes. Soft toe movements, spreading and curling. Light hand opening and closing. These activate what we call the muscle pumps without straining the heart. And these movements do not require strength. They require awareness. Even the weakest patient can perform them. When patients do this instinctively, color returns to their hands and feet. Because circulation improves almost immediately, blood begins to rise back toward the heart and brain. This also helps prevent cramping, and it reduces the risk of blood pooling that can prolong recovery. There is something comforting about this. It gives people something to do without putting them in danger. It replaces helplessness with participation, and participation restores confidence. The nervous system responds to that confidence. Stress hormones drop, recovery accelerates. Before I let you go, I want to share one more story that I hope will stay with you. There was a patient I will call William. He was 76, lived alone in a small house he had shared with his wife for 40 years. She had passed 2 years before. William called me after an incident that shook him deeply. He had been watering his garden when he felt a sudden wave of weakness wash over him. His knees buckled. He ended up on his back on the grass, staring up at the sky. His phone was inside the house. No neighbors in sight. For about 5 minutes, William was completely alone with whatever was happening to his body. But here is what William did. He lowered himself the rest of the way to the ground. Instead of trying to fight back up, he slowed his breathing, focusing on long exhales. He started talking out loud, describing the clouds above him, and he kept his hands and feet gently moving. When William came to see me, he was not traumatized. He was proud. He said, "Doc, I remembered what you told me. I stayed calm, I worked with my body, and I waited until I felt strong enough to crawl inside." William recovered fully that day, but more importantly, he gained something far more valuable than a phone ever could have given him. He gained confidence. He knew that even if something happened again, he would not be helpless. That story captures everything we have talked about today: position, breath, voice, movement. not random actions but a coordinated response, and once that sequence is learned, the body remembers it. Let me bring this all together for you now. When emergencies are discussed, people often imagine dramatic rescues, sirens, doors opening, someone arriving just in time, but most survival happens long before that moment. Survival usually happens quietly, on the floor, in stillness, in the decisions no one else sees. What we have walked through today is not complicated, but it is powerful. The body does not rise to information, it rises to familiarity. What feels familiar feels safe, and what feels safe keeps the nervous system calm. I have noticed something in patients who survive these moments. Well, they do not describe fighting, they describe settling. They allow the body to do its job. They stop arguing with gravity. They stop rushing the breath. They stop panicking the mind. There is something deeply reassuring about knowing that survival does not depend on speed, strength, or technology. It depends on cooperation with the body, and the body is remarkably loyal when treated with respect. These moments are not tests of courage, they are tests of preparation, and preparation is something you can choose right now. You rehearse it gently, in your chair, on your bed, on the floor. If it is safe, you imagine the sequence, you let the body feel it, because when the moment comes, thinking disappears, but instinct remains, and instinct is built from repetition, not repetition under stress, repetition under calm. So let us recap the 5 strategies. Try these for 1 week, practicing them gently, and see how they feel. Number 1. Keep blood moving with small intentional movements. Even gentle ankle and hand motions can maintain circulation. Number 2. Use your voice to keep your brain engaged. Counting, naming objects, or repeating your name keeps neural circuits active. Number 3. Control your breath with longer exhales than inhales. This calms the nervous system faster than any other technique. Number 4. Lower yourself deliberately and cooperate with gravity. Position protects the brain. Number 5. In those first 10 seconds, stabilize instead of struggle. Calm prevents escalation. I want to leave everyone watching with this thought. The most important emergency tool you have is not in your pocket, it is already inside you, and once you learn how to use it, you never truly lose it, even in silence, even in stillness, especially then. And remember, this information is meant to educate and empower you, not replace the advice of your personal physician. Take what you have learned today and have a conversation with your doctor about what is right for you. If you found this helpful, if you learned something today that you can use, I would really appreciate it if you hit that subscribe button. I release new videos every week, specifically designed to help you take control of your health and maintain your independence as you get older. And I promise to always give you the science without the hype. Drop a comment below and tell me which of these 5 strategies are you going to practice first. I personally read every comment, and I would love to hear from you. If you know someone who lives alone or worries about emergencies, please share this video with them. You might be giving them information their doctor never had time to explain. Next week we will be talking about the warning signs your body gives you before a crisis happens and how to recognize them early. You will not want to miss it. Take care of yourself, and until next time, here is to your health.